Hi guys, welcome back. In this video we shall be talking about dengue. It's a very high time that we shall be talking about dengue because it's a rainy season, and rainy season you can see the dengue incidents go up, and this is due to because the water accumulation. So dengue is very common in developing countries, underdeveloped countries, and children are mostly very much affected. So where is this dengue being produced? Now this dengue has been transmitted by your mosquito and your housefly. The mosquito itself is not going to cause a dengue, but it is going to transmit the dengue infection. Okay, so where is this mosquito found in the first place? This mosquito, they breathe in stagnant water. What is a stagnant water? The water that is not flowing. Okay, where can you find this kind of water? Very commonly found is your water coolers. Is your refrigerators, is your ACs, is your tires, that is your along with this you are having your coconut shells along with a broken piece of container or a glass or a cup or a plate that is allowing the water to accumulate there. That is known as stagnant water. Very commonly also found in your the household pots, that is the flowering pots that you use to decorate. So you have to keep on changing all this and have to keep in mind that these places are where stagnation of water can occur, and the mosquito can breathe there and can transmit you dengue. Okay, so dengue infection you don't want you to happen in the first place. Yes, the treatments are good. You yourself automatically be healed, but the complication can arise and you can sometimes even die if the proper management is not done. Okay, so we don't want you to have dengue infection in the first place. So how do you prevent it? By preventing the water sources. Along with this, if you're using your liquid vaporizer when you sleep at night, wearing long sleeve trousers and pants, along with this if you're using your mosquito net, very good to go. Okay, so these are the things that you have to watch on in order to prevent this. But yes, prevention is not always possible. Let's say you have the infection. Now whenever we are talking about the dengue infection, we are always talking about in 4 subtypes. It is known as serotypes. In simple words, just imagine serotypes are like subtypes of dengue. There are 4 in numbers. These 4 can cause the same effect, same clinical features, same symptoms, but these are known as DEN1, DEN2, DEN3, DEN4. If you are infected with DEN1, just 1, mild. If you are infected with 2, more. If you are infected with DEN1 and 3, 1 and 4, 1 and 2. So in short, more number of subtypes are infected at the same time, more dangerous. And you have to remember, if you are infected with any subtype, that subtype you will not be infected in your lifetime. You will be having permanent immunity against that. Okay, so if you are having 2 subtypes involvement in the one setting, you will be having more severe. If you 3, more severe. If 4, more severe. If you are having just 1, less severe. Okay, and the one that you are infected, that will not cause you infection in the later part of your life because you are having permanent immunity against that. Okay, so it does not mean that you want to get infected DEN1, DEN2, DEN3, DEN4 at the same time, all 4, so that you can be safe later on. If you are getting infected all 4, you might even die. That can be very dangerous. And one thing you have to remember, if you had infected with dengue once in your lifetime, the next time you get infection with dengue, that can be more severe. Okay, that can be more severe and more deadlier. Okay, so you don't want to have dengue in the first place. Let's say worst comes to worst, you got infected with dengue. The next time if you get infection with dengue, it will be more severe, because in that time you will be getting a severe form of dengue that is known as dengue hemorrhagic fever or dengue shock syndrome. What is dengue hemorrhagic fever? Hemorrhage means there is bleeding and you are having fever. Where can be the bleeding? The bleeding can be anywhere inside your body, because your platelet counts, they drop to a very great extent in dengue. Along with this, you can also have dengue shock syndrome. That means your major organs in your body, including your brain, can stop working. Okay, this occurs, dengue shock syndrome and dengue hemorrhagic fever occurs in complicated form of dengue, or if you had a previous infection of dengue. Okay, so you don't want to have all this. Okay, so this is about the basic rough idea about dengue that you should remember. Now coming to the main part, what is the symptoms? Just tell the symptoms. How do you know that you are having dengue fever or you are having a dengue infection? The incubation period is around 2 to 7 days. 2 to 7 days. That means your body will require around 2 days, from 2 to 7 days, to show the symptoms. That is the meaning of incubation period. The time taken by your body to show the symptoms, that's known as the incubation period. Okay. So what are the symptoms? You are having a multiple number of symptoms. You will be having fever, you will be having retroorbital pain, you will be having lacrimation, you will be having tiredness, weakness, you will be having not feeling like to eat, you will be having depression, you will be having lethargy, joint pain, body pain. Along with this, you will be having rash, you will be having fever. So what are the main symptoms that you should watch out? Okay, the main symptoms you have to watch out is that retroorbital pain. This is retro means behind, orbit means this is the orbit, it's inside the orbit. Okay, it's a socket behind the eye. If you're having pain, it's dangerous. Along with this, if you move your eye, the pain will increase. That is also very typical of dengue. Along with this, you will be having a rash. Now rash, you have to be very careful to understand this rash. Now this rash will be macular papular rash, which is blanching. Now what does it mean? Macules means let's say if I'm having a spot here. Okay, if I'm having a spot, that is the meaning of macule. Okay, if I run my fingers above this lesion, above that discoloration, I will not feel a bump, or I will not feel an elevation. That is a macule. But same if I'm having a discoloration here, if I run my fingers and I can feel a bump, or I can feel a elevation, that is a papule. Okay, so in dengue you will be finding macular papular rash, which is blanching. What does blanching means? If I press that area, the discoloration goes out. That is known as blanching. Okay, so again, the rash that you'll find in dengue will be macular papular rash, which is blanching. That means there will be a discoloration, and if you feel the discoloration, there will be a elevation, there will be a bump, and if you press on that area, the blanching and the discoloration go out. Along with this, very typical is the retroorbital pain behind your eyes, and if you move your eyeball left, right, up and down, you will be having pain. Along with this, very typical is a fever. Now this fever will be continuous. That means in morning also you are having fever, at night also you are having fever, and this fever will last you from around 7 to 8 days, and will be continuous, morning, evening, whole time will be having. But yes, on the 4th or the 5th day of this course, there will be a break in the fever. That is what you have to remember. Yes, other symptoms will be having headache, nausea, vomiting, abdominal pain, you will be having weakness, joint pain. These are the remaining symptoms. But you have to also understand one very important is that you will be having very severe kind of body pain, very severe body pain. That is a reason it's also known as break bone fever. That means if you break your bone, imagine the amount of pain, and you'll be having fever. That is also a very typical of dengue. Okay, these are the symptoms. Now you know that you're having symptoms, you're going to the hospital. In hospital, again, they are going to see, yes, are you coming from an endemic area? Are you coming from a place where there is more number of dengue, or any place where there is outbreak of dengue? Okay, so they'll ask that. Along with this, they'll ask your travel history. Did you go to jungle? Did you go anywhere there is more amount of dengue? Along with this, they're going to ask you the clinical features. That is the symptoms they're going to see: orbital pain, retroorbital pain, pain on movement, fever, very severe body pain, abdominal pain, nausea, vomiting. What are the type of rash? Now this rash will be typically seen in your trunk, that is your chest area. Okay, this part. Along with this, now this rash can later spread to your hands also. Okay, so once this thing is done, now they will confirm it by doing an investigation. By diagnosis is done by PCR. In PCR, we are trying to find out the genetic material of the organism. In COVID-19 also we are doing PCR. We are trying to find out the genetic material of the COVID virus. Okay, coronavirus we are trying to find out. Same genetic material we are trying to find out in the dengue also by doing PCR. Along with this, they can also do a serology test, in which they are going to see your antibodies, because your antibodies will go up in order to fight the dengue infection. What antibodies will go up? IgG. It's an antibody. It will increase up to 4 folds. Okay, 4 times will be increasing. Then we know that you're having dengue infection. Now, okay, the symptoms are done. You know that you're having dengue. What is the treatment? Now again, this treatment is divided into 3 parts. Okay, if you're having just dengue fever, they'll let you go home. If you're having dengue hemorrhagic fever, they'll keep you in the hospital. If you're having dengue shock syndrome, they'll admit you in ICU. Dengue normal fever, they'll tell you to drink a lot of water over a solution, go home and relax and take a rest, and they'll tell you to watch out for some danger signs that I'll tell you in the later part of this video. Now let's say you're having dengue hemorrhagic fever, that means bleeding is going on. So they'll be checking your hematocrit level. That means they're going to keep on checking your how much amount of blood is there, how much amount of RBC, platelets, all these cells that is present in your blood. They're going to keep on monitoring. If that hematocrit level reduces to normal, from normal, if it reduces, they're going to give you fresh blood. they are going to give you entire blood. Okay, they're going to give you blood via IV line. If this value is normal, then they are going to just give you hydration, that is fluids they are going to give you by the normal saline. Okay, IV line, they can give you normal saline. It depends on the doctor. Okay, but if the hematocrit level, that means the cell in your blood is reducing, that means you're having severe bleeding inside the body. That time, if we give you fluids, you will be diluting the remaining solutes in your blood only. It will be more dangerous. That time we will directly give you frozen, whole blood. We'll give you directly whole blood. Okay, that is known as blood transfusion. Will give you. Now, if you're having dengue shock syndrome, it's most dangerous. That means your kidney will be stop functioning, your brain will be stop functioning. Then we will be doing very intensive care. We might also need you to give a positive pressure in your lungs. Okay, we need to see your blood pressure doesn't fall down. We need to increase your blood pressure. So all this thing is done in the ICU. Okay, remember, dengue shock syndrome or dengue hemorrhagic fever will occur if you had a previous history of infection of dengue. Okay, that is the reason you don't want to get infected with dengue again. First thing, you don't want to get infection with dengue. Let's say you got infected, bad luck, you don't want to get infection later time again. Okay, these are the management. So in short, there is no typical management of dengue. There is no drug. It's mostly supportive. If you're having shock, we will support your blood pressure, will support your entire normal bodily function. If you're having hemorrhage, if your blood level drops, that is the hematocrit level drops from normal, okay, then we'll give you whole blood. And if it is normal, we'll give you fluids. And if you're having just dengue fever, we'll let you go home, good oral intake and take rest. That will help you to resolve the problem. Now, the thing is that you have to remember, if you are having dengue, if you go home or at home or at hospital also, there are some danger symptoms that you have to watch. What are the danger symptoms? You are having severe abdominal pain, severe abdominal pain, you have to watch out. It's a danger, red flags. Okay, if you are vomiting, very much you're vomiting, you're not able to eat, it's just vomiting. If you are having altered sensorium, that means you're not able to say, is it day, is it night, you're not able to say your time, you're not able to say estimated date, you're not able to say this means your brain is affected, that means you're trying to going in shock. Along with this, if you're having the stool, it becomes black, that means there's bleeding in your stomach. The blood is red, but the red blood is getting reacted with the acid in your stomach, that is converted to black. Okay, and now if you are severely weak, okay, severely weak, then you can know that you are having this thing. Okay, red flag. So again, remember the shock symptoms, that is you're not able to say day, night, or what, like you're confused. Along with this, you have to see if you are your blood pressure is going down. Okay, along with see if your hands and this extremities are getting pale, that means you're going in shock. Along with this, you have to see your color of your stool, very severe pain, very much vomiting, and you are going very sick. That is the danger symptoms. Along with this, you have to remember, whenever you are having this much of pain, you are going to take the painkillers. Okay, remember, you're not supposed to take aspirin. Okay, if you take aspirin, it will make the blood more thinner and it can make you more problematic. That means it can put you in more chance of bleeding, because aspirin will not allow the blood to coagulate. Along with this, if you're having this pain, try to limit the take of ibuprofen, because ibuprofen is a bit more aggressive to your stomach. Okay, it can cause you bleeding, and if you have bleeding, this bleeding will not stop because the platelet count has gone down. So the painkiller management have to be, it's like a balance. Okay, you have to be very, very careful. That is the reason, whenever you're having pain, you have to talk to your doctor. It has to be balanced with the side effect and the advantage. Okay, yes, I do understand that will be very, very severe pain, but you have to understand all the NSAIDs that you take as a painkiller, that is going to irritate your stomach lining and can sometimes cause you ulcer, and you don't want to have an ulcer, you don't want to have this. Along with this, you have to remember the red flags is that any orifice from your nose, from your mouth, from your eyes, from your ears, from your penis, from your anal tract, if you're having any bleeding, you have to be very, very dangerous. Okay, it's a red flag. So remember the symptoms, remember to avoid the breathing ground in the first place, remember the symptoms, good water intake, go to your hospital, they'll check you, and you don't want to get infection in the first place. If you had a previous history of dengue, you don't want to get infection in the second place. That's all for now. I'll see you in the next video. Thank you.